Hello everyone, I'm Dr. Michael Sistare, Palm Beach's newest cosmetic surgeon. Thankfully, I have the opportunity to talk to you about a procedure today called a facelift. Thank you for watching. A facelift is one of the most commonly performed aesthetic surgeries in the country. I get asked frequently a few different questions that are repeated to me over and over again, and I wanted to address those questions with you today. First question I get asked is, what particular attributes of the face does a facelift address? So there's a few different procedures that are done on the face, and they all target different areas. The main three procedures are something called a brow lift, which addresses above the eyes, a facelift or a mid-facelift, which addresses between the eyes and the jawline, and then a neck lift, which addresses from the jawline to the clavicles, the collarbones. So when you're talking about facelift, it specifically addresses between the line drawn through your eyes and your chin. The other areas of the face can be addressed indirectly through a facelift, but if your main complaints are associated with sagging tissues of your forehead or your neck, a facelift might not be the first choice. And it's something that you need to address with a conversation that you have with your surgeon before undergoing surgery, so everyone's on the same page and so that you're undergoing the right procedure. So a facelift addresses specifically deeper wrinkles below your eyes, around your nose, around the corners of your mouth, and these marionette lines, these vertical lines that come underneath the corners of your lips. What it doesn't address is very fine wrinkles and skin quality. Those are better addressed with either injectables like Botox or filler, or cosmeceuticals, topical medicines that plump the skin and make it more youthful. The facelift specifically addresses deeper lines. That's why it tends to be older people who undergo facelifts. When it comes to cost effectiveness, facelift is by and far more cost effective than getting injectables like Botox and filler multiple times a year for many years, because an individual facelift's results are supposed to last somewhere between 10 and 15 years, depending on the surgical technique that is employed in your initial surgery and the quality of skin that the person has and the type of recovery that they have as well. Speaking of recovery, I guess, what is the recovery like from a facelift? And in order to answer this question appropriately, I have to tell you a little bit more about the procedure itself. So the facelift is accomplished using a particular technique called the tumescent technique. We inject what is essentially water with anesthetic and epinephrine in it underneath the skin of your face and on top of the muscle. This accomplishes a few different things. One, it expands the distance between the skin of your face and the muscle underneath, which gives your surgeon area in which to work. The epinephrine in the mixture decreases the bleeding that one would encounter in the middle of surgery. And also the lidocaine that we put in the solution decreases any kind of pain that you would feel afterwards. It's very effective at decreasing the pain of the procedure. So as a result of the fluid that we put there, that the surgeons put there, you wake up and you look at yourself in the mirror and you're very swollen. That's not you, that's us. We put that there. But as a result of that fluid not being fluid that you made, it tends to go away pretty quickly. 80 to 90% of the swelling that you see immediately after surgery is going to be gone by the next morning. You do have some lingering swelling that tends to dissipate over the following 1 to 2 weeks. Other things that you can experience is some tenderness, especially a few days after the procedure. Some bruising, it's not uncommon, but the bruising from a facelift tends to be very minimal. And maybe a little bit of pain, although a lot of people don't tell me about any pain at all. This tends to be a very tolerated, very comfortable procedure to undergo. I get asked, what are the scars like? Well, that depends specifically on what type of facelift you're going to do and the extent to which you are going to lift and reposition the tissues of the face. Generally, the scars go from right in front of the tuft of hair in front of your ear, swoops around the tuft of hair in front of your ear, follows that natural crease between your ear and your face, and then loops around the bottom of your earlobe and trails up behind your ear as is necessary to lift up the tissues. We choose that area because, one, it gives us excellent access to the tissues of the face underneath, and two, it's very well hidden once it heals. So that incision is going to be obvious for the first 1 to 2 weeks following surgery, but after that incision heals, the scars are almost imperceptible. It depends a lot on your previous history of healing and how much pigment you have in your skin. There's a few different things that a few different steps you can take in order to minimize the visibility of your scars. The most important of which, and the thing that I stress to my patients, is you have to stay out of direct sunlight when your scars are healing. Direct sunlight to a healing incision will permanently darken it and make it more obvious. So you wear sunscreens, you wear hats when you go outside. I prefer that you don't go outside, especially in the first few weeks following surgery. But if you follow these steps and you treat your scars appropriately, they are almost imperceptible. You can find it if you really look for it, but it's certainly not going to be noticeable. That's the facelift in a nutshell. Thank you so much for listening and watching. If you have any questions, post to the comments underneath, and I'll do my best to address them individually. But once again, the practice of Palm Beach Cosmetic Surgery. I'm looking forward to meet you, and come meet with me, and we'll discuss how I can help you achieve your aesthetic goals.